Good morning and welcome to Fall Prevention for Older Adults. We have two speakers for you today, so it's a special treat and it's a very interesting and in-demand topic. So as always, this webinar is brought to you by our wonderful sponsors, O'Connor Mortuary, Caring Companions at Home, Care Choices, Hospice and Palliative Services, and Alzheimer's Orange County. And I'm Kim Bailey, and I'm a gerontologist with Alzheimer's Orange County. As most of you know, our sponsors are committed to providing these free webinars as a service to the community on topics that are beneficial to anyone who's caring for an older adult or working with the older adult population. So I think you're going to find today's presentation especially useful and informative. So we'll go to the next slide. I'll talk about the other face that you see. That's Lori Cleary, and she'll be our first speaker today. She serves as the Older Adult Fall Prevention Specialist at the Washington State Department of Health, where she manages contracts for evidence-based fall prevention programs, collaborates with fall prevention advocates to develop new fall prevention coalitions, and works with Alan Abe, our second speaker today, to develop and share fall prevention education. Prior to her work there, she served as the Injury Prevention Specialist at the West Region EMS and Trauma Care Council for 9 years, where she coordinated an annual injury prevention workshop for EMS providers and managed the Prevention Grant Program, awarding many grants for older adult fall prevention, as well as child safety, teen driver safety, water safety, and other prevention programs. And then if you'll go to the next slide, Lori, I'll tell you about Alan Abe. He is the Injury Prevention Specialist at the Washington State Department of Health in the EMS and Trauma section. In this position, he assists fire and EMS hospitals on a statewide basis in developing their injury prevention programs. Prior to this, Alan retired from King County Emergency Medical Services in 2019 as the Injury Prevention Program Manager, where he developed an EMS-based fall prevention program that reduced reoccurring falls by 83% and developed other prevention programs such as distracted driving enforcement, child passenger safety programs, exercise programs, and more. So we have two eminently qualified presenters today, and Alan, we'll say goodbye to you for now. We'll bring you back in just a little while after Lori's presentation. And Lori, I'm going to go ahead and turn it over to you. Thank you.
And hi, welcome. I'm happy to be here this morning. And as she said, I am with the Older Adult Fall Prevention Program at Washington State Department of Health. And you can learn more about our program by visiting our website. We have a lot of great resources and information available. Falls are the biggest threat to older adults' ability to remain independent, active, and continue to live in their own home. But the most important thing to remember is that falls are preventable. They're not a normal part of aging. So why should we be concerned about falls? A fall doesn't have to be from a high elevation, such as falling off a roof, to cause a serious injury or death. And a ground level fall can cause a severe life-altering injury. It can start a decline in health that leads to premature death and also necessitates moving into a long-term care facility. 1 in 5 falls result in injury, and the most common injuries are hip fracture and traumatic brain injury. 95% of the hip fractures for older adults are due to a fall, often due to falling sideways. Give you a little bit of data for Washington State because that's where we're from. And in 2020, falls are the leading cause of injury-related deaths for adults 65 years and older, and they account for 57% of injury-related deaths for older adults. The risk increases with age, with those older than 80 having a significantly higher risk. TBI-related hospitalizations for older adults is 126.5 per 100,000. That's 11 times higher than the rate for individuals who are younger than 60 years. And according to the CDC in 2018 in California, roughly 1 in 3 adults 65 years and older reported a fall, with older adults with dementia 2 to 3 times more likely to have a fall. And new fall prevention programs are being developed specifically for this population, which is really exciting. So what do older adults think about falls? If an older adult falls, they often attribute it to an external factor. They don't think of it as a fall. They think of it as a slip trip. They slid out of bed, or they tripped over their dog, or they didn't see the last stairs. They don't see it as a modifiable health risk factor or lack of exercise. They often don't tell their doctor or family members that they fell. Or they have a fear of falling because they're embarrassed or they're afraid of losing their independence. They found out that if somebody found out that they fell, that they would no longer be able to remain at home. One of their greatest fears is that they'll lose their independence and have to move to assisted living and out of the home and community that they've lived in for many years. Most older adults want to remain independent and in their own home and community as they age. And by preventing falls, we can help them to achieve that goal. We want to be able to continue to safely participate in the activities that bring us joy as we age. As far as public education and awareness, a lot of older adults are not receptive to fall prevention messaging. They often think it's not relevant to them, or it's something that happens to somebody else. They often don't think they're at risk, sometimes even if they've had a fall, again, because they attribute it to an external factor. But older adults are interested in learning how they can stay safe, independent, and how they can age in place, They're interested in learning how they can maintain a good quality of life as they age. Last year, Department of Health developed the Finding Our Balance public education campaign, and we created several flyers that are available in multiple languages on our website. The flyers can be printed directly from our website as well. These are some of the flyers, and the one in the middle is the home safety flyer that we created. It's a checklist that you can use as you walk through your home to help you identify fall risks, as well as what you can do to mitigate those risks. And this is the exercise flyer. It just gives a brief overview of some of the evidence-based fall prevention programs. And the second page also has some simple strength and balance exercises from the Stay Active and Independent for Life, or SAIL program. Medication management. Medication management is an important component of falls prevention. Some medications or combinations of medications can increase risk of falls. It can cause dizziness or other side effects that will increase your risk. So it's important to have all medications reviewed on a regular basis by a primary care provider or pharmacist, especially if you're getting medications prescribed from multiple providers. And be sure to include over-the-counter medications, supplements, recreational drugs, even alcohol can sometimes interact with medication, so it's good to include those as well. And anyone who's taking 4 or more prescription medications, it automatically increases your risk of falls. And most older adults are taking much more than that. Here are some great resources to learn more about medication management and what you can do to reduce the impact, the falls impact. So the CDC fact sheet, and there's lots of resources here. But one of the things that's important is to dispose of unwanted or unneeded medications. It helps to reduce the risk of medication errors, and you can bring your unwanted medications to a safe disposal site. The DEA coordinates a National Prescription Drug Take-Back Day twice a year in April and October. And there are some locations, such as law enforcement agencies, that will accept unwanted medications year-round. It's important to talk to your doctor if you fell or if you have a fear of falling. Fear of falling is something that can happen after someone has had a fall or if they notice they're starting to feel a little bit unsteady. But if you could go ahead and talk to your doctor about your fear of falling, they can help to identify and address any health issues that might be contributing that, as well as to help you know what steps you can take to stay safe and falls-free and independent. Vision and hearing checks are important as well. Hearing is an important component of balance, and so it's important to have an audiologist check your hearing regularly. And vision is also important for falls prevention because it makes it harder. If you have poor vision, it's harder to judge distance or see trip hazards. It also makes it more difficult to read prescription bottles so that you can make sure that you're taking the correct prescription and that you're using the correct dose. And then update glasses regularly as needed. And now to address fear of falling. Fear of falling can lead to decreased activity, and decreased activity can lead to deconditioning, which in turn increases your risk of falls. And Matter of Balance is a group class designed to reduce fear of falling and find practical strategies to reduce risk and increase activity levels. It can be delivered one-on-one or as a group, and participants learn to view falls as preventable, and they learn the importance of exercise in preventing falls, and it empowers older adults by helping them to identify the risk factors and strategies that work best for them. Strength and balance. Regular exercise that targets strength and balance is the single most important activity that older adults can do to stay active and reduce their risk of falling, and it has a wealth of other health benefits as well. This is a great video here on the link below that just shows the significant impact that exercise can have just on our ability to age well and reduce our risk of falls and make it possible for us to continue to engage in the activities that bring us joy. During the pandemic, evidence-based fall prevention classes were all closed down out of just concern for safety. And as a result, some older adults have experienced deconditioning and loss of function. Many evidence-based programs, or possibly all, can now be delivered in person, remotely, or hybrid. And hybrid just gives them the option to participate either online or in person, whatever works best for them. And the benefit to that is that older adults who live in rural communities where there are no classes, they're now able to participate. And some classes have participants from multiple states in the same class. The other benefit is sometimes older adults just aren't able to get transportation to a class. So this just opens up a new opportunity for them. And there's unique safety concerns for the virtual classes. And so some of the safety is first and foremost for all of the instructors, but there are some steps that are unique for the remote classes. Some instructors will require that the participant gets a note from their doctor ensuring that it's safe for them to participate. Another safety measure is some of the exercises are modified just to make them safer, or else are removed altogether from virtual delivery. And some of the modifications can include making sure you have a sturdy chair to hang on to, or a table or desk or something, just in case you kind of start to feel a little bit unsteady. And then also instructors make sure that they have contact information for somebody who could get there quickly in case the worst happens and someone does have a fall or other medical emergency. And there are many great evidence-based fall prevention programs out there. You can talk to your medical provider before starting a new program just to find out which one is best for you or for your loved one. Enhanced Fitness is a great evidence-based program just for anyone who wants to reduce their risk of falls. Sound Generations out of Seattle, Washington is piloting a new version of Enhanced Fitness that's specifically for older adults with dementia or Alzheimer's, and they are training caregivers to deliver the program to the older adult. A false talk for caregivers. This one doesn't include exercise. It's more behavioral modification. And this is for anyone who is an older adult who's interested in learning to reduce their risk of falls. But there's a new version that has just been developed, and it is still kind of being piloted, where caregivers are trained to deliver the program to older adults with mild cognitive impairment, including Alzheimer's. And early research shows this to be very promising, so I'm excited about that as well. Otago is another great evidence-based program. And it focuses on increasing strength and balance and includes a walking program. And a study has shown this to also be effective for older adults with Alzheimer's. Otago is best suited and shows the most improvement for frail older adults, those who are 80 years and older. And one of our partners here in Washington State is piloting an Otago class at an assisted living facility. That's a group class. Stay Active and Independent for Life, or SAIL. It's a group class that includes stretching, aerobics, as well as balance. And we have SAIL videos that you can see online at the website here. Tai Chi Quan Moving for Better Balance has a very strong focus on balance, and it's very effective, reduces risk of falls by 58%. As far as balance, it helps you to, I guess, become better able to regain your balance after a disturbance, like if you trip over a curb or something, so that you can regain balance and not fall. And for more information on all the evidence-based programs that are available out there, and there's many, you can visit the NCOI website below and learn more about those. This video is just a really brief video, but it's just a great overview of things that can be a risk, that can increase your risk of falls, and simple tips to prevent a fall. It's great to share with older adults, families, caregivers, or anyone who works with older adults. Here's some more great resources. And the second resource there, one of our local hospitals developed a comprehensive fall prevention information packet, and they give that to their patients, every patient who's being discharged from the emergency department due to a fall-related injury. And you can access the packet online, and you are welcome to download the packet and modify it and use it in your own hospital if you feel that's something, or facility that would be helpful to you. One of the other great resources is the Washington Poison Center. They have a webpage that's dedicated specifically to older adult medication management. There's a wealth of resources and information here that's great to refer to. And I believe we'll be doing questions at the end, if that's correct.
That is correct, Lori. Thank you so much for your presentation. And next we are going to bring back Alan Abe to do his presentation.
I will be talking about how to assess a person for fall risk and identifying and mitigating fall hazards in the home. This is kind of good news and bad news. For the folks who have various chronic health conditions, they are at more risk of falling. However, the good news is there is a so-called magic pill that can reduce chronic health conditions. It can also slow down the effects of dementia, and it will also reduce fall risk. That is exercise. There are various behaviors that you could watch a person walk and to decide if they're at fall risk. I kind of categorize these people in different categories. This first one is, I call them the shuffler. They tend to shuffle their feet real slowly. They walk slow. They can't lift up their legs to go over a curb. And it may be due to various physical illnesses, maybe neuropathy, or they may have a fear of falling, or lack of leg strength, lack of balance, or maybe some vision issues. The next category of people, I call them the speedster. They just got to get up and go as fast as they can to go from point A to point B. They, from a sitting position, they stand up very quickly, which may cause dizziness, and therefore they're also at risk of falling. And these people may not see the path that they're walking on. They may trip over the pet rock or find a slippery slope and fall off of that. Now, the next category of folks, I couldn't find a penguin video, but I classify these folks as the what you call the furniture walkers. They will walk and touch furniture and the wall to kind of make them feel steady and more secure. So all these behaviors are an indication of fall risks. Let's jump right into the home environmental factors. We all know that 50 to 70% of the falls occur in the home. So just some minor modifications in the home can reduce the risk for falling. Let's jump into the bathroom area. Some folks may have to use an assisted device, such as a four-wheel walker or two-wheeled walker, and they may have to, sometimes the walker too wide to get through the door, so they tend to leave their walker outside of the door or somehow turn sideways and get into the bathroom. That's very dangerous for the person. So my suggestion is that a lot of the walkers on the frame, they have the wheels on the outside of the walkers. Take those off, put them on the inside of the walker. Therefore, it makes your walker maybe 2 or 3 inches narrower than you could get through that narrow door to the bathroom. Once you're in a bathroom, having a night light that is light sensitive or motion sensitive is great to have. Another thing is the non-skid bath mats or non-slip shower slippers. And if they have difficulty in standing off the toilet seat, what you can do is install what they call a comfort seat, which is about 2 or 3 inches, a little bit taller than a standard toilet seat. If that doesn't work out for you, wall bar works out great against the side wall there. Or if you don't have enough space for a wall bar, I would suggest installing a lockable toilet seat riser, which is about 2 or 3 inches tall. If they don't like to sit on that, then there's another option called the toilet assist frame. It has kind of like arms that come out to the side and it's bolted to the two bolts that attach to the toilet seat lid. If the person has difficulties getting in and out of the shower or bathtub, I would suggest at least installing 2 wall bars. A vertical wall bar on the outside of the tub area next to the shower head, a horizontal wall bar underneath the shower head at the front end of the tub area. And if you can, either a diagonal or a horizontal wall bar on the long wall. Sometimes an individual is kind of unstable standing in the shower or the tub area, so I would suggest having an adjustable shower chair there along with a handheld shower head. Also, folks may have weak leg strength, that they can't really lift their legs above the tub wall. There's 2 things you can do. That is to install a tub grab bar onto the side wall, but make sure the tub is not made out of plastic or fiberglass, as the tub grab bar may crack that tub. There is another device that is called a transfer bench, which is more or less an elongated shower chair. It just kind of straddles the tub wall. And I think that covers the bathroom area. On to the kitchen. For items that are placed too high, you could use a reacher or a grabber, but I would prefer to move those items that are frequently used to put them at a lower shelf, preferably waist high. I don't really like to use a stepping stool because that could be a fall hazard as well, but if they need to use a step stool, make sure it has a handle on there. For some odd reason, I don't know why, but everybody has throw rugs in their kitchen. My girlfriend has throw rugs, her whole family has throw rugs, and it must be a genetic thing or something, but those can be dangerous. Get rid of those throw rugs, or if you really want a throw rug, make sure there is a non-slip pad underneath it, but make sure it's not very high because that can be a trip hazard as well. Next is the bedroom. Night lights, again, is nice to have. If they use an assisted device, a walker or a cane, make sure it's close to the bed. One thing you have to make sure is that the height of the bed is the proper height. As the person is sitting on the bed, make sure that the feet are flat on the floor. Otherwise, if they can't reach the floor, that means they have to jump on the bed to get into the bed or jump off the bed, which is that's a fall that could occur fairly easily. Bedding, sheets on the bed, make sure it's off the floor. Some people have a difficult time getting in and out of the bed. So there's a few things you can use. A floor to ceiling pole that is located near the head of the bed to grab onto that, to sit on the bed, grab on it to get out of the bed. Or another thing called the trapeze. You have to install it on the ceiling, which is quite a bit more expensive. Some people like to use a thing called the bed assist railing, which goes in between the top mattress and the box springs. But that could be very dangerous because it could cause a head entrapment in that. So make sure if you use that, make sure it's a proper fit. I think we have now the stairways. For the stairs, I think it's a building code to have railings for steps that are 2 or 3 steps. For the actual stairs itself, I would prefer to have railings on both sides of the steps. Make sure that the steps are clear of any obstacles. If you have carpeting on the steps, repair the carpet if it's torn. If there's hardwood floors on the steps, you can put tread tape on it. Make sure the light switches are at the top and the bottom. And if possible, on the very last step and the top step, on the edge of those 2 steps, make it contrasting colors so that as the person is walking down the step, the contrasting colors would notify the person that, hey, I'm on the last step, be very careful. If there is no door at the top of the step to kind of shut off the steps from people falling into down the stairs, You could install a lockable child gate. That can help out quite as well. I think we covered most of the rooms. On to individual assessments. There are many ways to assess an individual for fall risk. There is a self-assessment form, a checkup form by NCOA, the National Council on Aging. It has 12 questions. Each question has a ranking system, 1 or 2 points. Should the person who takes the test scores more than 4 points, that means they're at risk for a fall. Now, there are various clinical ways to assess a person for fall risk. There is the sit-to-stand test, the tug test, timed up and go test, the Romberg balance test, the functional reach test, and the 4-stage balance test. I'm just going to briefly go over the sit-to-stand and timed up and go test. I may go over a couple others depending on time-wise. The sit-to-stand test is basically how many stands can they do within a 30-second time period. Make sure they have a sturdy chair. Standard chair is about 17 to 18 inches for the seat itself. Make sure the chair is up against the wall. As the person sits on the chair, they can have one foot slightly ahead of the other foot for balance, and they could sit at the kind of like in the middle part of the chair. They don't have to have their back against the back part of the chair. So if they do less than 12 stands for age of 65 and above, that means they're at risk for a fall. However, it is age adjusted. The older you are, the less stands you have to do. If the person has to use their hands to push themselves up, that's not counted as a stand. However, if the person makes it halfway up, you could count that as a full stand. The next one is the tug test, which is basically using the same chair, armchair. You mark off 10 feet, mark that 10 feet, and the goal is to stand from a sitting position, walk to 10 feet, turn around, come back, and sit back down. And if the person does it greater than 12 seconds, who is 65 years and older, they're at risk for a fall. Once again, this is age adjusted. The older you are, the more time it's going to take. I think I have a couple more minutes. There are some other tests you can do. The 4-stage test, it's test your balance. You have the individual stand with their feet together and hold that for 10 seconds. If they don't sway or move their feet, then you move on to the next stage. Next stage is to have your big toe touch the instep of your other foot, and then they stand for 10 seconds. If they don't sway or move their feet, then you go on to the next stage, which is a tandem position. Your toes touch the heel of the other foot, so you're tandem. You stand for 10 seconds. If they don't sway or move their feet, then you go on to the 4th stage, you stand 1 foot. If they sway or move their feet at any of those stages, that means they're at risk for a fall. The Romberg test, balance test, you do it without shoes. Stand with the feet together. Cross your hands, either cross your arms in front of you or just lay it drop your arms along your side. Stand there, I think it was for 30 seconds with eyes open. Then test them with the eyes closed. If during the test, if their eyes are closed, if they start swaying, then they're at risk for falling as well. I think that's all I have. I'm sure there's going to be lots of questions we can answer.
Thank you so much, Alan and Lori, both. That was such a, if you'll pardon the pun, such a well-balanced presentation. We had all the great background research from Lori, as well as all those resources you pointed us to, Lori, and then Alan, you had, the practical application piece, telling us things that we can do in our homes to improve safety and, all of the adjustments that can be made. So I'm really so thankful that both of you were here today to address this important topic. And Lori, you came and went. So can you come back on your webcam? There you are. Great. Okay. So now it's time for me to open up the question box and see what questions we have for our presenters. And if you haven't yet put your question in, it's not too late to submit it. You can just go ahead and put it in the chat for Lori or Alan. Okay. Let's take a look. Are some styles of walkers better than others? Does a walker make the person shuffle too much? So talking about adaptive equipment here, and there's lots of different walkers. So what do you think?
Walkers, that's a tough one. Best answer I could give you, pick the walker that best fits your particular height and your needs. Most walkers are adjustable. Walkers, if you're on Medicare, Medicare should pay for most mobility devices. However, Medicare does not pay for any DMEs like wall grab bars and toilet seat risers and that sort of thing. There is a program out of Medicaid that can pay for some DMEs, but I would talk with your physician, as your physician will have to prescribe a walker for you, and then Medicare will most likely cover that. But your physician should know the size, or if you actually go to a PT or OT, and they will help you with that as well. It's important that you have the proper size. If it's too low, you'd be bent over. If it's too high, you'd be, it's very difficult. Good question.
Yeah, Alan, I'm probably wrong on this, but isn't it your hands should be like at your hips?
Yeah, kind of like almost perpendicular to your body, 90 degrees.
Okay.
It also depends on what other physical issues you have. You may have arthritis in the hands or in the legs, that sort of thing. So it kind of depends. A PT would have a better idea.
Okay. And I like those walkers that have the seat in them to give the person an opportunity to rest as they're traveling along too. Anything you want to add to that, Lori, or do you think that's well covered?
I think you did a great job of explaining that.
I think one thing you should be aware of, they should have the braking system.
Right. Absolutely.
Some walkers may or may not have, but a good braking system is good to have.
And those are usually squeeze brakes,
yeah,
right?
or they can, or they can push it forward and it locks the whole walker.
Gotcha. Okay. Our next question is, what kinds of shoes are best for enduring stability?
Oh, good shoes. Okay, first off, you should have heel cups. Strong heel cups so that your heel fits snugly in the back part of the heel. Don't use slippers that don't have any heel cups. Those are real fall hazards. If you have trouble bending over, they do have shoes out of Velcro. My dad used to have that all the time versus, lacing them up, just have a Velcro. One that fits snugly. One that has some tread, but not really thick tread, because that may become a trip hazard, especially if you're a shuffler. One that bends at the proper location on your arch and your front part of your toe, your forefront.
Okay. Great. Thank you. When you were talking about those different tests for the Romberg with the eyes closed, should the arms be extended in front of the person when they're doing that?
There's two ways to do it, either hanging below, just on your side, or crossed in front of your chest. Not extended, just crossed or hanging below.
Okay, thank you. The next one is from a caregiver she's caring for an 82-year-old client, and that client is a fall risk. She's fallen 3 times since February, mainly in the bathroom. She's got bars, but the main issue is that she doesn't like shoes. How can I help prevent her from falling, or convincing her that she needs to wear shoes?
Oh, wow, yes. Is this a family caregiver, you think, or?
No, it's a professional.
Professional caregiver.
Mm-hmm.
Doesn't like to wear shoes, so she's got to go. She's either going barefoot or wearing floppy slippers. Floppy slippers. I mean, to tell you the truth, I'm from Hawaii. I walk barefoot all the time in my house. But for an older person, yes, shoes is important. How do you tell a person? You can't use a scare tactic because that's not going to work. Maybe get the family involved. However,
That's a good idea.
you know what
Yeah.
really works is when she does fall again, an EMS responds, a firefighter responds to help them pick her up. Folks tend to trust firefighters. So if you could kind of get one of the firefighters to persuade that firefighter, say, can you tell this person to wear their shoes? And that may make that individual to start wearing shoes. Because I know a lot of the older folks, they respect firefighters, they respect people in white coats. So I think a firefighter, when they do respond, they might have a good word with her. That might help out.
That is an excellent suggestion. And another thing, I mean, along the same lines, you could have the doctor talk to the client as well. I don't know if this client has Alzheimer's or not, but if she has Alzheimer's disease, then you could have the doctor write a note. You are required to wear shoes at all times when walking.
Yeah, that's what I meant.
Or you could write the note and sign it from the doctor. You know, we have to get a little creative sometimes.
That's what I meant by white coats. I mean, the doctors wear those white long coats. So yes.
Absolutely. Oh, okay, good. Can you recommend a walker for seniors that have vision issues like macular degeneration? And they also have neuropathy in their feet from diabetes. So, oh my gosh, between the vision and the neuropathy, that's pretty tough, right?
Yeah. There isn't a walker I would recommend because I don't want to put myself out there for liability reasons wise. I suggest talk to your doctor, talk to a physical therapist. If they tend to forget to use a walker, there are little, I guess, not a chain or a rope, but one of those goes around your wrist and you attach it to the walker. So that kind of may remind them, hey, I got this rope attached to my walker. I better go get my walker. You know, if they have dementia or that sort of thing. But to answer your question, I'd say talk to your physical therapist. Hate to say that, but there isn't one particular walker I would recommend.
Yeah, it almost sounds like they need for safety, they need a wheelchair perhaps. What do you think, Lori?
That is a tough one. Yeah, again, a physical therapist would know best what's best for that specific individual.
If you do go to the wheelchair concept, I would suggest maybe a transport chair. They're a little smaller, a little lighter. They have smaller wheels.
Good. Thank you. For someone who lives at home with family, what's a good amount of time for us to assist our person to do daily exercises? So what's a good time frame for exercises? Maybe we'll give this one to Lori. Lori, you mentioned several different exercise programs and resources. So what's a good time slot there?
First of all, because everybody has different physical abilities, especially as we age, check with your doctor first. But as a general rule, I believe it's 150 minutes a week that's recommended. So yeah, that could be strength and balance definitely should be a priority for exercise. That's what's going to reduce your falls, but any movement is good. Any movement is good, whether it's walking or, whatever brings you joy.
Right. I was thinking that really does have to do with their own physical capabilities, right? I mean, it's going to vary from individual to individual. Alan, do you want to weigh in on that as well?
If they haven't exercised for a long time, I would just say start off with just a few minutes a day, or 5 minutes in the morning time, 5 minutes in the afternoon, and slowly extend that to where you can do a longer time period, an hour a day or half hour a day. But start off slow. Any exercise is good, it doesn't have to be evidence-based for me, but just get them off the bed, off the couch, start walking or do some stretching or soup cans. Anything will help, especially if they're just starting out. But make sure the doctor gives the okay.
Absolutely. And that exercise promotes brain health too. So
Mhm.
it has so many benefits. Let's see. What do you suggest for dementia residents who are living in memory care? For instance, those that attempt to get out of their wheelchairs or beds, forgetting that they can no longer walk. Oh boy.
If they're in a residential setting or a facility, they do have these things called bed alarms or floor alarms. You could put next to the bed or in the bed itself or on the wheelchair. So once they do get off, the alarm will go off. So that will notify the staff. I would suggest that.
Absolutely. Yeah, I mean, if you have folks that are forgetting how to walk, then they require, supervision and support throughout the night. And the mats can be helpful. There's also monitors where you can hear them, getting up. But yeah, that's a terrible risk, and so it requires adequate staffing. If someone has difficulty getting out of bed due to a bad back, do you have any assisted devices that you can recommend to help them get up safely without walking? Without falling, I'm sorry. And you did talk about a couple of different devices.
Yeah, there's
Right,
the floor to ceiling pole. There are ones where it's kind of like suction cup types, but they're not as sturdy. There are ones that's more sturdy where you have to drill into the floor and drill into the ceiling. Put those next to the head of the bed, the pillow area, so they can grab onto that. There is the trapeze, which is kind of like a triangular device that you screw into the wall. You hold onto that, lift yourself up. I'm not sure if Medicare or Medicaid pays for part of that. I'm not really sure about that. It has to be prescribed, I think. There is also that bed assist railing. That's can be dangerous. It's a long pole that goes in between the top mattress and the box springs, and it comes up maybe about 5 inches above the top part of the mattress. If you don't have a thick mattress to cover that whole area, your head could be entrapped to that and cause head entrapment issues. So I would be very careful if you use that sort of thing. If you do use that, there's a strap that goes around the box springs on the bottom, so it holds it down. Other than that, so those are only 3 things I would recommend. I would recommend the floor to ceiling pole first. We had a person who just came up with a crazy idea. I think Laura knows about this as well. They used a pool noodle, those 2-inch pool noodles, and put it alongside of the bed so they don't fall out of the bed underneath all the sheets and everything. But that doesn't really help them to get out of bed, but it just helps them from not falling out of bed.
That's all great. Thank you so much. And then there's another question that I think you basically just answered, but the emphasis was just on this particular person having problems with skin breaks and bruising and all of that. So really fragile skin. And she notices that her elbows are bruised from picking herself up at night. And so as far as lifting someone out of bed, there's some of those devices that Ellen just talked about can be really helpful, and you just have to be really careful transferring her. And remember to not pull on her, but pull on the sheets, to try to assist her in moving, right, Ellen and Lori? Anything else you would add to that?
The fire department personnel uses a system called the Hoyer lift. It's fairly expensive, a few $1,000s, I think $3,000 to $5,000. It's kind of like you slide it next to their person, and then the person kind of rolls over onto this lift, and it kind of slowly lifts you up, kind of like one of those recline chairs, that kind of slowly lifts you up from the sitting position to the standing position. Same concept, fairly expensive. I'm not sure an individual can afford that, but that's another idea.
Right.
But using the bed sheets to move the person is a great idea as well.
Thank you, Alan. If a doctor determines that the patient has a balance problem, Does that mean it's unsafe for them to drive? How do you get them in and out of the car safely? Okay.
Driving a car.
Yeah, if they have a balance problem, I'm not a doctor and
Yeah.
I'm not qualified like you two are, but it seems to me that if they have a balance problem, that they probably have other issues as well that might render them unsafe to drive. And you can call our helpline. We have referrals to driving safety programs where they actually, an OT, an occupational therapist, will test the person in a number of different areas to determine if they're safe to drive. So I would recommend that you call our helpline for that information, and getting someone in and out of the car safely. Alan and Lori, would that be similar to getting them in and out of bed safely? I mean, we're talking about different transfers here.
Yeah, transferring. I would use an assisted device like a two-wheeled walker next to the door or next to the seat. Have them swivel their legs over outside of the door, and then have them hold on to the four-wheel or two-wheel walker and lift themselves up. But then again, you have to have some leg strength to do that.
Yeah.
You can also use a gait belt.
Mm-hmm.
Gait belt goes around the individual who's helping the person, goes around the patient that needs a lift. It's a big, thick belt, you might say, and helps them lift up, or helps them from falling as well.
So you can get that at a medical supply store. Again, our helpline can give you some referrals for that, but anyone you're caring for that you feel is a fall risk, the gait belt is so helpful, not only for the patient, but to avoid injury in you, the caregiver. So,
are there PTs or OTs on this webinar that can maybe help answer that question?
Everybody's on mute, and we have a pretty large audience, so I'm not really sure that we have that resource available, right now. But yeah, I think that'd be difficult, but it's just reinforcing what you've been saying, you and Lori both, that talking to a physical therapist or arranging for physical therapy assistance for your clients can be a plus, and that's usually covered by Medicare. So is it a good idea to put rubber or plastic tiles in the shower to prevent falls? I've seen a lot of these on Amazon, but I'm not sure it's a good idea. Tiles, are you aware, either of you aware of them?
Never heard of that before.
I haven't heard of that, but you could call a medical supply store that sells durable medical equipment, and perhaps ask about that. Or you saw it on Amazon, I would read the reviews. There's usually a number of reviews that you could read to see if that might be a good product. Let's see. Is an upright walker better than a regular one? My parent is a petite woman, and while I don't want her to be bent over, I also do not want her to be overwhelmed by the size of the walker.
I've seen those on TV. I picture a person being bent over because the current walker they're using is the wrong height, or they may have some bone issues that makes them bent over like that. But I think maybe first check to make sure that the walker they're using is at the right height, the hand portion, before you go to upright walker. I have no idea how those upright walkers work. They look fabulous on TV, but you may have some other physical ailments that may not have you standing upright like that. But once again, a PT should answer that question. Take your walker to, if you can get your doctor to make a referral to a PT, should be covered by Medicare.
Okay, thank you. The next question is, can a pharmacist help provide information about what medications will cause balance problems? And Lori, I think you were talking a lot about medications. What do you think? Should they talk to their pharmacist?
Definitely, yeah, at least every year. And what we've called it is just a brown bag where you put all the medications with the original prescription bottles in a bag. You make an appointment, talk to your pharmacist, have them review everything. So yeah, definitely they should know. There's something called a Beers List, BERS, that pharmacists should have access to. There's also the Steady Stopping Elderly Accidents, Deaths, and Injuries program that some hospitals are a part of, and they also have a program for pharmacists as well. So yeah, they should definitely know. That's a great resource.
Thank you, Lori. Do either of you know anything about a good shower shoe, or just in general what you need for this kind of shoe? Do you think I would say, do you think they're necessary, or what's the benefit of wearing a shower? Is that just to keep from slipping? Or do you know about that, either of you?
I don't know the brands of any shower slippers or shoes out there.
Okay.
No.
Yeah, I don't know if they're sold in medical supply stores or pharmacy outlets, but you could try that, or Amazon, and again, read the reviews.
I'm quickly looking.
Oh, someone just said, Alan, there actually was a picture of those tiles on your presentation. So we'll have to look into that more, right?
There was?
I guess so. I've never heard of those. I cared for someone and I just used the safest mat that I could.
Yeah, there was a picture of a bath mat.
Bath mat is what I always used. Yeah. Someone is just saying that you can use a transfer board to get in and out of the car. And I imagine you can use that in bed as well, right? And I've known caregivers who actually put the large, I probably shouldn't share this, but they used the large garbage bags and had the person seated on them, and then they could easily twist them around, again, pulling on the bag instead of pulling on the person. But that's just a
good
home remedy. But the transfer board is good. Yeah. Should the older adult conduct the fall risk assessment by themselves, or does it require another person to administer it?
Are they talking about the self-assessment?
Okay, so
if they're talking about the self-assessment, yes, they can do it themselves if they're honest with themselves, or have a family member assist them.
And they'd have to be free from cognitive impairment, right? Okay. Someone's commenting that they think the upright walkers are great. They take pressure off the wrists, the weight's on the forearms, eyes can focus forward so the person can see ahead of them. Also, the head upright reduces the depression from looking down. So, and it enables them to make better eye contact with people. So that's nice to hear.
Good to know.
And then she added a footnote. However, if the person has severe arthritis of neck and spine, that's going to make it difficult to stand up straight. Okay. All right. Let me check my time. We are coming to the end of our time together, and I do have a couple of announcements to make before we end the webinar. So we'll end the questions and answers. You see the information on your screen for both of our presenters. If you did not get your question answered, you can reach out to them. But in the meantime, before we end, I just want to thank them both again. This information is so needed, and we've had requests for it, lots of requests. So we appreciate your time and attention to this topic. And speaking of topics, don't forget to save the date of Tuesday, August 9th for our next webinar. And the title is Music Therapy and its Impact on Dementia. And we will be featuring Karen Skipper, who is actually does programs with us here at ALS OC, and also music therapy sessions at our Healthy Aging Center in Laguna Woods. And she is a wonderful resource, and so we're excited to have her again on Tuesday, August 9th at 11:30 a.m. And before we end for today, I'd just like to take a moment to once again thank our generous sponsors who enable us to provide these topics that are of such great interest to those of us who are working in the aging field or those who have family members that they're caring for. So big thanks to O'Connor Mortuary, to Care Choices, Hospice and Palliative Services, Caring Companions at Home, and of course, ALS OC. As I end the webinar, you should have your evaluation pop up on your screen so that you can go ahead and get that accomplished so that it will expedite the receiving of your certificate. And as always, if you're interested in any other education programs and classes that are offered through ALS OC, you can visit our website at www.alzoc.org, and we invite you to do so. Thanks again to both of our presenters and to all of you for sharing this time with us today. And we'll see you next month.